Now from Capitol Hill, Republican Senator Rand Paul of Kentucky. He's a member of the Health, Education, Labor, and Pensions Committee, I should say, as well as the Foreign Relations Committee. Senator, thanks so much for joining us.
Thank you, Wolf.
All right, so we have a lot to discuss on health care, but quickly I want to get your reaction to the president's tweets saying that he didn't record his conversations with the former FBI director, James Comey. I'll read it to you. He said, with all of the recently reported electronic surveillance, intercepts, unmasking, and illegal leaking of information, I have no idea whether there are tapes or recordings of my conversations with James Comey, but I did not make and do not have any such recordings. Your reaction?
Well, you know, I'm in a similar position to the president. I kind of worry about who's been recording whose conversations and who's been leaking them to the press. I've been asking the intelligence community for a couple of months now, did the Obama administration surveil me in any way? And I'm hoping to get an answer, hopefully in the next few days. But I think all of us are worried about too much spying on American citizens, particularly without any kind of warrant or any kind of probable cause.
So do you think that it's possible that there are tapes, but the president doesn't know about those tapes, recordings of the conversation that he had with Comey, that the surveillance may have been secret? Is that what I'm hearing from you?
Well, what I'm very concerned about is there was an article in the Washington Post last year talking about how President Obama was minimized, meaning that they listened to his conversation, knew who it was, and they blacked out his name. I don't think the intelligence community should be listening to any president, Republican or Democrat. So yes, I am concerned, and I think the rules need to be explicit that they don't listen to the president and that they don't listen to members of Congress and that the president doesn't listen to members of Congress. We have to have much more control over privacy because it's gotten out of hand. And what happened to General Flynn could happen to any ordinary citizen, and that shouldn't happen in America where they listen to your private phone call and then take you down by releasing things to the media.
So what evidence do you have, Senator, because this is a pretty startling accusation that the intelligence community may be spying on the President of the United States?
We know that they spied on Flynn because the media reported the contents of his conversation. That's what got him in trouble with saying one thing privately and then maybe another thing to the people in administration. But they only knew that because someone eavesdropped on a private conversation. I have no evidence that they're listening to this president or have, but there was a Washington Post article, and it's been somewhat disputed in the presentation, but it said that President Obama was minimized 1,500 times, meaning they would have had to listen to his conversation 1,500 times. Now, the author now has changed his presentation of those facts, but it does concern me that if we're listening to every foreigner, we would also be listening to prominent Americans talking to foreigners.
I want to move on to health care, Senator, but with Michael Flynn, I think what was going on, the law enforcement intelligence community was spying on Russians who had conversations with Flynn, and he was incidentally picked up in those conversations. They weren't listening in on his conversation specifically. They were targeting Russians.
Yeah, but they illegally then leaked those conversations to the media, which is a major felony and worthy of actual time in jail.
All right, let's move on. Let's get to health care. I know this is very much on your mind right now. Today, you and 3 of your colleagues came out in opposition to the bill as released today. First of all, have you read the entire bill? I have a copy here. It's more than 140 pages, and it's very, very, I got to tell you, I tried to get through it myself. It's very complex.
It's not going to win any Pulitzer Prizes for reading, I can tell you that. I'm about a third of the way through it, and I'll be through it by the weekend. But, you know, I proposed all along we should have a Read the Bills Act, which says for every 20 pages of text, there should be one day, one working day, a Monday through a Friday, to evaluate the bill. Because I think we do need more time to be able to read and get through it. Because it's not a matter of just reading it. If you've read through these things, you're reading it and then referencing it to other parts of the federal code. So it takes a while. We have a dozen people, half a dozen people or more reading it in my office, but I will also read it personally. I got it this morning and have not made it all the way through it yet.
Yeah, it's not easy reading, I got to tell you. All right, your Democratic colleague, Senator Chris Murphy of Connecticut, he said today that any Republican opposition to this bill, in his words, is merely prescripted political theater. This is what he tweeted. Senate will try to follow House script. 1, Senate R's act concern. 2, pass meaningless amendments. 3, claim bill is fixed. 4, fall in line. Is your opposition to this bill political theater?
Well, Senator Murphy and I do a lot of things together on some issues, but on this, you know, we disagree. My opposition has been principled in the sense that I think that the marketplace works better. I think freedom works better than coercion. And I think the federal government shouldn't be giving any money to insurance companies. Insurance companies made $15 billion in profit last year. The new Republican bill will give them $110 billion to bring down prices. But to me, that's sort of a ludicrous economic concept. That would be like telling America new cars cost too much, so we're going to have a stabilization fund so your new car will cost less, or food costs too much, or any number of things, education, and we're going to subsidize the cost to bring it down. It sort of ignores the fact that our annual budget is $500 billion in debt. I don't know how we're going to pay for all this new spending.
Listen to what the president told voters about his health care vision when he was out on the campaign trail.
Save Medicare, Medicaid, and Social Security without cuts.
I'm not going to cut Medicare or Medicaid.
You're going to end up with great health care for a fraction of the price.
He wants this Senate version to have no cuts in Medicaid, but there are hundreds of billions of dollars potentially in cuts that have been included. So is the president keeping his promise?
Well, I think the thing that we have to examine about Medicaid expansion is I think that under Obamacare it was dishonest accounting, because what we did is we expanded it to a lot of new people, maybe 12 million new people, but we paid for it all at the federal government level. And really nothing at the federal government level is really paid for. We borrow the money. So we're $500 billion in the hole. We had trouble funding traditional Medicare, Medicaid, food stamps, and Social Security before we expanded into Obamacare. There isn't enough money up here for everything, and I think we just need to be honest with the American people. If people want Medicaid expansion, the most honest way is to say the states should pay for it, and then the states will have to raise taxes. And then people will get a very visible trade-off. In Kentucky, we have 450,000 new people on Medicaid. It should completely be a state function. The federal government shouldn't be expanding it, and the state should say, we've got to pay the traditional percentage we pay if we want to do this. But the governor has told me, and everybody in the legislature has told me, they don't have enough money. So really, we're just not being honest. We want things from government, but we don't want to pay the taxes for them.
Senator, you're a physician. Do you support Obamacare's mandate to cover pre-existing conditions? Because this bill won't necessarily cover treatment for pre-existing conditions because it allows states to waive the federal mandate on what insurers must cover, known as essential health benefits. This could potentially mean that you could cover a person with cancer, but not necessarily pay for that person's chemotherapy. You support that?
I think in all likelihood, actually, this bill largely keeps the pre-existing clause that was in Obamacare. But we have to realize, and this is where we have to sort of have a big heart and also use our brain as well. The death spiral of Obamacare is because we tell people you can buy insurance after you get sick. But then we add regulatory burden, those essential health benefits that raise the cost. So if I'm a working guy in the United States and I make $30,000 a year, but because of the additional regulatory problems that my insurance costs $10,000, and you tell me, oh, you can buy it also after you get sick, nobody's going to buy insurance. People are smart enough to avoid buying insurance. That's what happened. That's the death spiral that is Obamacare. That's one of my points about not supporting this bill is actually I think it keeps the pre-existing condition, keeps the regulations, and then subsidizes the death spiral. That's my real complaint. We are not fixing Obamacare. The problems of Obamacare will remain and may get worse. We're going to dump a bunch of taxpayer money that's going to wind up in the coffers of very, very wealthy insurance companies.
Very quickly, will this bill pass?
Not in its existing form, and that was the point of coming out early. There's 4 of us, can't pass. Could pass if they'll work with us. We want to sit down with them across the table with leadership, and we want to negotiate a better bill.
All right, Senator Rand Paul, thanks so much for joining us.
Thank you.